Well, I have to tell you something. The doctor wants to see my mom again because they found a lump.
Does that mean that they're going to have to cut off her breast?
Oh, no. I have a friend who found out she had a lump. They removed it, and she was fine after that.
There are many different treatments these days. Listen, I know many women who've had breast cancer and have lived long, full, wonderful lives after treatment.
In the first part of this DVD, we talked about protecting ourselves against breast cancer by getting breast cancer screening. For most of us, we'll be lucky to be told those words, "Everything looks normal." For some of us, the news may be scary. Hearing that your breast cancer screening has found an abnormality can be very frightening. You may hear a lot of different things from your friends about what is in store for you. It may all seem overwhelming and confusing. Many of us think that we know something about breast cancer. But what we think we know is not always accurate. Friends may want to be helpful, but their information may not be correct either. This is why it is very important that you talk to your doctor about your next steps. If you are told by your doctor that your breast cancer screening is suspicious, it is more important than ever to make sure you understand what procedures and questions you will be facing in the days and weeks ahead. It's important to have a doctor with whom you can communicate. And when you are diagnosed with a breast abnormality, this becomes even more important. At this point, many more healthcare providers are likely to become involved with you. A family doctor, a radiologist, a pathologist, and perhaps a surgeon, and an oncologist. They may not know you, your needs, or the ways in which to communicate with you. You should seek out the assistance of your local deaf and hard of hearing agency if necessary. To make sure you have a medical team that can meet your communication needs. The agency can provide you with this service. Remember, you will be given choices and may be asked to make decisions that can have an important impact on your future well-being. Make sure you can communicate with your medical team. In Chapter 4 of this DVD, called Getting Information, we talk more about the steps you can take to ensure that you get the information and services you need, and that all of your questions are answered.
You know, I'm really nervous about all this. I'm really not sure what to even ask my mom's doctor. My mom's deaf too. I have to carefully plan for getting a qualified interpreter for us at her appointment. I don't want to have any miscommunication.
Oh, yeah. That's true for all of us. We all have to have good communication when we go to the doctor because it's such a challenge. Do you know if your mother will need more tests? And what kinds?
I think she will need more tests. I hope it works out.
Yeah.
We may be told that based on our mammogram or clinical breast exam, the doctor would like us to have more tests. What now? I'd like to ask our friend, Dr. Carolyn Stern, to help us walk through what happens when doctors think they've found something suspicious. First, remember that an abnormality may be benign or cancerous. Your doctor may need to perform more tests to determine whether the abnormality is benign or cancerous. These tests may include any or all of the following:
The yearly mammogram is used to screen for breast cancer. Usually only a few x-rays are taken. But if doctors suspect that a woman might have breast cancer, additional mammograms may be needed. More x-rays provide more detailed information about the breast problem. Those additional mammograms are called diagnostic mammograms. An ultrasound is a painless test that can help determine if the lump is cancer or something else. Many women often notice changes in their breast, and these might be nothing to worry about. But the doctor uses an additional test, such as the ultrasound, to see if it is a fluid-filled sac or cyst, or maybe a solid lump. The ultrasound helps the doctor decide if any further tests are needed. Sometimes it's still not clear if it is cancer. The only way to be sure is to do more tests. In one procedure, some of the tissue that is suspicious is removed and sent out for analysis. This is called a biopsy. A biopsy can be done with either a needle or surgery. The cells are then examined under a microscope by a pathologist. The pathologist then informs your doctor what he saw. There are two kinds of needle biopsies. One, fine needle aspiration, or FNA. The other is a core biopsy. In FNA, the procedure is as follows. Fluid from the lump is drawn through a thin needle into a syringe, which is sent to the pathologist to look for cancer. In a core biopsy, a thicker needle is used. With this procedure, the thicker needle can then remove some of the lump for analysis. There are also two kinds of surgical biopsies. An incisional biopsy is a procedure where the doctor removes a small part of the lump. There is also an excisional biopsy. Remember, I explained previously how lymph nodes are often the first place breast cancer is found if the cancer has spread. During a surgical biopsy, sometimes your surgeon may also want to remove the surrounding lymph nodes for examination. The pathologist examines these lymph nodes for any evidence that the breast cancer has begun to spread. To find out more about the lymph system, just select the "What is the lymph system?" button that appears on your screen. Biopsies do not usually require a stay in the hospital overnight. They are usually done on an outpatient basis and may take several hours or more of your time. After the patient has been prepared for the procedure, the doctor uses a local anesthetic to numb the affected area. If women are nervous or anxious, they may be offered the choice of having a sedative for the procedure. When the procedure is done, the patient is moved to a special area to recover. The doctor comes in after the patient wakes up to check things over. The patient can usually go home the same day. If your doctor suspects you may have breast cancer, these terms are often used in conversation: diagnostic mammograms, ultrasound, biopsy, needle biopsy, core biopsy, and surgical biopsy.